My name's Judith Proctor and I'm delighted to be invited to chair today's conference. I'm the Chief Officer for Aberdeen City's Health and Care Partnership, fairly newly appointed, so I'm really looking forward to meeting as many of you as possible today and finding out more about self-directed support here in Aberdeen and where we can join together the work that we're trying to do in integration with all the work that you're doing. I'm passionate about self-directed support. I've worked in that in previous roles, so I think what we're doing is hugely important and I'm dying to hear more about it. We've got some fantastic speakers today, but first of all, to open our conference, I'm going to introduce Councillor Leslie Dunbar. Leslie is one of the co-chairs of our integrated joint board here in Aberdeen, so she's been steering us to really focus on the outcomes that we're going to achieve through that piece of work.
It's great to be here and to see so many of us keen to meet up to talk about how we can build our communities together. From April 2015, we'll see a new body set up to oversee the integration of health and social care services in the city. And we spend a lot of time just now talking about the organisational changes that we'll see when adult services from NHS Grampian and social care services in Aberdeen City Council come together. But unless we have a commitment to facilitate more community building, capacity building and community development in our communities, we won't see the transformational change that we need in our communities. We're only beginning really, I think, to imagine the kinds of new changes we need to see, and that's why today's conference is so important, because today we have the opportunity not only to hear from our invited experts, but to have our imaginations fired up and become Imagineers together. Today we have the opportunity to build our futures together, and I'm certainly going to listen carefully to people's thoughts and ideas and hear today how we can use the assets that we already have to make everyone's lives more fulfilling and develop our communities together.
We're very lucky to have Cormac Russell with us. Cormac is Managing Director of Nurture Development and a Director of the Assets-Based Community Development in Europe. In January 2011, Cormac was appointed to the Expert Reference Group on Community Organising and Communities First. So delighted to welcome Cormac this morning to challenge our thinking.
I don't know that we're going to think our way into one community. I think we're going to act our way into it. We're going to practice our way into it. If we want to change our practice, we have to practice the change, right? So part of that is not behaving like institutional people, not thinking that self-directed support is an institutional reform agenda. It's not. You will not commission this. You will not reform your systems to make this happen. This is a social movement, driven in free space by free people who define themselves not as clients of your services, but as citizens in a democracy. So let's just talk to each other, because that could be the most radical revolutionary act of all.
David Brindle is with us today and we're very lucky that he's here in Aberdeen. David is the Public Services Editor for the Guardian newspaper and he specialises in areas of social policy issues and has won numerous awards for his coverage of health and social care and around supporting the voluntary sector.
We have hit the wall in terms of public funding, and we're looking at another 4-5 years at least of austerity. So we have to make this stuff that we're talking about today work. Civic mobilisation, I think, is the way forward. It's the antidote to what Cormac has called in the past the death rattle of the welfare state, and there is definitely a death rattle out there if you listen carefully. It's the asset community. It's the way, in my judgment, we're going to get through all of this. So thank you very much.
I would say one of the main things I think has been really good about this conference is that it's stood up to its title, One Community, because it's brought all these different organisations, including the local authority, Aberdeen City Council, together, so that as professionals, whether we're here on a voluntary capacity or a paid capacity. It's about us networking and really strengthening our bonds with each other, so that we really do work from a partnership footing to the betterment of our citizens of Aberdeen.
I found it really inspiring, because I think a lot of the things I've been hearing at the discussion, well, the presentations, are things that I'm looking into and finding out about, and it's really interesting that people out there are also thinking about all these different things, and then bringing it back to the local context about how people here can then make a change locally. And we've been discussing from both our different organisations' points of view about all these different connections between people in communities, in streets, what's happening, what's not happening, and it just has made us really think and talk a lot about that just now.
Absolutely, and we've been able to connect, although we'd connected on the internet, and but we didn't realise that we had connected on the internet, if you like, so we've been able today to do a face-to-face connection, and hopefully we'll take that forward. And for me, what today's all about is that start of that way of sort of having a dialogue with people to make them understand what the mechanism of self-directed support can do for them. And the next stage, hopefully on from today, is how we actually engage with those people who are the ones that need the services, need their outcomes met in a new, different way, and SDS is maybe a route for them to be able to do that.
And I think it's bringing things back to the beginning, as in self-directed support doesn't need to be people being helped to get services. It's looking to having things within your community, as well as paid for services, but things in the community that can help you live. We need to help people, or help them live, not have them living around their care services. The care services are there to help them live and have a life, and help them be less isolated at home because they're waiting for the services to come home, but to let them get out and have that life. And self-directed support, we hope, will help them do that.
I was very pleased to see such a great turnout and interest in self-directed support up here in Aberdeen. And I think the contrast between the aspirational asset-based conversation we had with Cormac mixed with the reality check of David was an interesting combination. And from our perspective, it's about making sure that services are responsive to people's outcomes, so that their assets are utilised within the context of providing better, more person-centred services.
But all social change, including the social change that you seek here today, happens in small, little ways, to the corner of our eyes, behind our back, when individuals get connected, not on the basis of their deficits, but on the basis of their assets. So you know, in the final analysis, the revolution, which I think is what we're about today, that you seek, will only fully come about when people who have been defined as the problem secure the power to redefine the problem. So on with the revolution. Thank you.